Hey there, so my name is Alison Lee. I'm a veterinary anatomic pathologist and I'm doing a PhD at Trinity College Dublin as part of the Irish Clinical Academic Training Programme on feline oral cancer. So I'm going to talk about veterinary pathology more generally today, but using my own research topic as an example. So, veterinary pathology is the study of diseases in animals, and it's kind of broken into two branches. So, there's anatomic pathology, which is what I do. So, we do postmortems on animals to establish a cause of death, and we also look at tissues under the microscope, which is called histopathology. And then there's clinical pathology, which deals more with tests on body fluids like blood tests, hormone tests, urine tests. And they also examine cells under the microscope called cytology. So it's a really interesting job. It's a bit like Dexter meets CSI meets Supervet, and never boring, sometimes a little bit messy. So I'm going to use a real life case example just to show you what it's like when animals need pathology. So this is a little cat called Flipper, and her owner noticed a lump under her chin back in April 2020. Flipper was brought to the vet, who examined her mouth and found a rather nasty looking mass or lump along her gum line. So at this point, the vet doesn't know what this is. They're going to have to do some further tests. So we have two main options here. So one is cytology, as I said. So this involves inserting a needle into the lump or the mass or maybe the organ you're interested in. And then you use air in a syringe to expel any cells or material in the metal needle onto some glass slides, which are stained and examined under the microscope. So alternatively, in histopathology, the animal is usually put under general anesthetic and a solid piece of tissue is removed from the mass or the organ. It's preserved in formaldehyde. A small piece of tissue is cut off this and it goes through a tissue processor. It's then embedded into a wax block, and very thin slices of this are cut, put on black glass slides, stained and examined under the microscope. And you can now just bring up an image of what these look like. Thank you. So these are two images, one showing cytology and one of histopathology of the disease that the cat Flipper was eventually diagnosed with. So on the left, we see in cytology, we have these individual cells, they're tumor cells, and they're kind of big blue cells scattered all over the slide, and they're all separated from each other because they've been sucked out with the needle. And there's a lot of red blood cells, so the little brownish grey round objects in the background mixed in with them. So this test is usually fairly cheap and quick. You don't normally need an anesthetic, but you don't see the tissue architecture, so sometimes you need a biopsy to follow up. So then on the right, we see our histopathology example. It's like a one-dimensional cross-section through our tumor, so you have tissue architecture. However, it's usually more expensive. The results may take longer to come back, and often an anesthetic is required to take the sample. But you usually get a good result. So poor little Flipper was diagnosed with feline oral squamous cell carcinoma, which is what I'm studying. This is a common mouth cancer in cats, and sadly, there's no effective treatment. Flipper did receive radiation therapy, but she was unfortunately put to sleep in July of 2020. So my research project involves studying whether oral bacteria in the mouth might influence the development of this tumor. So please keep in touch or stay tuned for any interesting results. Thank you.